with no ortho. Here is the new BG Dental case of aesthetic rehabilitation by means of porcelain veneers in situation when patient refused orthodontic treatment. How did we solve the case? See now. Hello dear friends, we are back with the BG Dental cases, and this time will be a very interesting and controversial clinical case of aesthetic rehabilitation with porcelain veneers in a situation when patient actually needed orthodontic treatment, and I was trying to convince this patient to switch to the orthodontic treatment first, but patient refused. And I will share you step by step how actually I resolved the case and how I planned the case and what kind of tips and tricks I used to make this case more or less conservative. At the very beginning, I would like to admire and to highlight actually that I'm a big fan of orthodontic treatments, especially in cases when I really realize that I cannot do aesthetic treatment without ortho because of specific position of patient's teeth, or I realize that my restorative treatment will be very aggressive. In this case, I even refuse some patients for treatments, and I have a big list of patients when they came for veneers or for crowns with their rotations, with crowding, and I didn't make anything because I knew that restorative treatment will not bring a good result. But this case is different, this case is special, this case is interesting, so let me actually move on with discussion. And by the way, if you are watching now, watching us for the first time, I would like to say that similar cases or case series we have in our video list, which you can find below this video in description. There will be the link to our YouTube playlist with similar mini webinars. So feel free to watch them and to take a lot of useful tips and tricks for your daily practice. Okay, so that is the initial situation. Patient asked us for veneers, and I was really aware of his canine. The canines were very prominent and protrusive. So I imagined that if case will go to veneers, for example, how much I need to prep these canines for making veneers on. So I was about to refuse the case, but once I got enough time to plan, to see, I realized that we can. So another thing that we have, another problem that we have is caries defects, fillings, cracks, and many aspects of defects on incisors. So let me move on with intraoral pictures. Here you can see occlusal pictures, upper and lower jaw. And definitely this patient needs orthodontic treatment because he has narrow occlusal arches. His premolars are it's not a retroclined, let's say, and definitely it's not just an aesthetic case. This case has to be done in a more complex way, in more interdisciplinary way. Okay, but again, I didn't find enough words to convince this patient for orthodontic treatment, and the patient said, no, I don't want nothing, no ortho, no Invisalign, nothing. I want to have these veneers as soon as possible. I was dreaming about these veneers all of my life, and so on and so on and so on. So I sit down, I calmed down, and I started to examine, to evaluate the case. So first of all, let's check from the palatal side. From the palatal side, we have multiple caries defects. Here, filling 1, 2, actually no palatal wall on the central incisor, caries. So basically interproximal areas of these incisors, and maybe canine here, I don't remember exactly, are affected. So if I would need to prep them, actually we will need to prep anyways because of the caries defects. So my preparations will be caries driven here. Okay, so we have to do that. Another thing is, if we will take a look on this picture, by the way, I would like to recommend you to have this picture in your protocol, because this picture is very useful to understand position of patient's teeth. This picture is like 90 degrees to the incisal edges of central incisors. What this picture gives us? It gives us understanding, position, and volume. Okay? So when I sat down and I started to evaluate the case, to analyze the case, the first question that I asked to myself, actually I'm always asking this question to myself when we do veneers or crowns, is if we can add something above the surface, if we can be additive. This is the thing. This is the key point to be minimally invasive. In which cases we can add? We can add when teeth are flat or plain, or when they are retroclined. Okay, so we can add something above. I don't know exactly how much, but let's say yes or no. Yes, we can. In his case, let's take a look. In his case, his central incisors are straight, are plain, flat. So basically I can add. Let's just imagine I will take my pencil or stylus and we can just add. I don't know how much we can add here. Just let us assume. By the way, this case is pretty old. And nowadays, utilizing digital workflow, digital protocols, and softwares like Exocad, for example, we can really plan precise that kind of cases. We can see virtually how much we add, how much we need to cut because of the position. We can also see the root surface roots because of the CBCT and intraoral scans that can be matched together in that softwares. But this case is pretty old and I just went to the conventional way. And if you are interested in that advanced approach in veneer cases, I would recommend you to come here to our training center to Kiev, Ukraine for a big veneer course. We have 3 days program, veneers from A to Z, from start to finish, when we also teach and show you virtual planning. Okay, so in this case, let's continue. Let us move on. We do some additive things. Okay, premolars definitely we can add because they are retruded, so we can add some ceramic over the surface. And now let us draw an aesthetic curve, and we see that we need to prep canines that much as I expected from the very beginning. Okay, just adding premolars, centrals, a little bit of the laterals, we can win the game. We can actually test this by the mock-up. We can ask our dental technician to do the wax-up, then we transfer this wax-up into the patient's mouth with the mock-up, and we see how much we add, and we see if the teeth are, let's say, over-contoured or normal contoured, and so on and so on. We can get a lot of information out of the planning. Okay, so in this case, after that simple planning that I showed you, I decided that we can go for veneers. We planned in conventional digital smile design way. We just analyzed proportions, smile curve, the aspects ratio between centrals, laterals, and canines, and everything looks very nice. We are not changing mesial distal aspects of teeth. We are not changing the length actually. So from the length point of view and proximal point of view, this is a non-aggressive case at all. The only thing, canines from the vestibular aspect. Okay, so we asked our dental technician to do the wax up, and then we proceed with treatment. Premolars. Let me show you premolars because they are pretty interesting. Since the position of these premolars allows us to be additive, we don't need to prep them from the vestibular side. We just make, let's say, a finish line. But there is always but in dentistry. There are caries defects here. There are caries defects. So we have to prep. After caries excavation, we have that kind of starting point, let's say. And before I will continue explaining and showing you things, I would like to ask you a question, okay? And I would like and also I have a small request for you, okay? Answer this question first, then you will watch the video, okay? So the question is, considering the necessity of veneering for these premolars and caries defects that we have, what type of restoration you will go for? Okay, so that is the question. What type of restoration you will go? We need to cover premolars from the vestibular side, and we have also caries defects. So maybe you will go for crown, or maybe you will go for veneer lay, or maybe you will go for veneer overlay, or just for veneer. I don't know. Please give your answer here, just write down, and then I will continue with put pausa, write down, and then continue playing the video. Okay, so I'm showing you now what I actually did here. Considering the fact that the cavities are very small and the cavities are surrounded by very thick walls, and there is no need to do anything from a occlusal point of view here. We're not changing video, for example, okay? We just do aesthetic treatment here. So considering all these mentioned facts, I can say that there is a strong indication in this case to do direct composite restoration and it will be very simple and fast approach. So actually we continued with composite restoration, direct composite restoration, done. And then we just prepped from vestibular aspect and make so-called window preparation for these premolars. So we combined direct and indirect restoration on one actually tooth, okay, on both of these teeth. If you don't know what is a window prep, for example, I can say that we have a surprise for you. We have prepared a PDF file which we call as Atlas of posterior veneer preparation, non-carious, without caries veneer preparations on posterior teeth. We have 5 different types there: window preparation, partial cusp reduction, single cusp reduction, veneer overlay, and tabletop restoration. So you can download the file. Just the link to this file is below to this video in description. So you just read the text, download the file, and you will have the guideline for yourself with the 5 different types of preparations for posterior teeth, for veneers, okay, with no caries defects. Okay, so next, and by the way, if you want to know more about that, to see how actually we can do that, I can invite you to attend our online masterclass, which is called Posterior Veneers, and I will broadcast live 5 different types of preparations in front of your eyes. So you will see everything step by step. It's like a guideline to prep posterior teeth for veneers. I will be preparing upper and lower teeth for porcelain veneers, and you'll be able to watch it. So the link to the online masterclass is also in the description for this, in this video, under this video, below this video. So let's go for frontal teeth. Tooth number 21 was endodontically treated. From palatal side there was no tooth at all, just filling, so that tooth will be a crown. Actually, we need to move to do something from the vestibular side. We don't have interproximal, we don't have palatal, so basically it is already crown. And here you can see straight after preparation all of these teeth, no dentin was exposed. All preparations were done in very conservative way, even with these canines that I was afraid at the very beginning. And patient actually was not anesthetized when I was preparing his canines. So basically I was very happy to provide that conservative preparations, considering the fact that in centrals and lateral incisors we have caries defects and fillings. We crossed interproximal contact, so basically we prepped them for type 3 veneers. And just we finished, we took impression, sent to the dental technicians. Here you can see some ceramic work flow from our dental lab, BG Dental Lab. You can see veneers and crowns done by my dental technician. By the way, Our dental lab is open source. Here you can see BG Dental Lab. You can actually go to Instagram. If you are Instagram user, you can go to Instagram, BG Dental Lab, and you can cooperate with our dental technicians. They can deliver veneers to any single country here by DHL, for example. Anyways, we go for next images. Isolation. You can see veneer and crown here. Just to compare, important information. This is important information. When you do crowns like Emax, for example, or lithium disilicate crowns, from palatal side, the minimum thickness for the crown should be about 0.7, 1 millimeter, okay, because of function. It is important. That's why you can see that my finish line from palatal side and all palatal aspect was prepared more than vestibular. Actually, vestibular margin is almost like, it's almost like here, pretty much the same, but palatal is different. Okay, here is from vestibular aspect, nice image of lateral incisor, just finish line, just delicate proximal preparations. Canine, that I was afraid at the very beginning during consultation, no dentin exposure, 0, so we are in enamel, very conservative preparation. Another canine, same thing, very delicate preps. Premolars, with no preparation, which means no prep at all from vestibular side in this case, just finish line in cervical area and finish line in proximal areas, just to guide our dental technician regarding position of the veneer. Okay, so here we have also another artistic picture, just bonded. Here is after bonding and before and after treatment. So planning that kind of interesting case in precise way, analyzing position of teeth, analyzing possibility to be additive, we can do some interesting and conservative workflows with veneers in case when patient absolutely refuses orthodontic treatment. But I want to highlight this information, it is not always. There are many cases where we have to go for orthodontic treatment. Otherwise, we may destroy patient's teeth and we will not get aesthetic result. And all parts of process will be unsatisfied and unhappy. Patient will be unhappy and you as professional will be unhappy because the result may be not as you expected. Okay, so you have to be careful. So guys, was happy to present that interesting case for you. I would like to wish you to be healthy and may the dental force be with you. Bye bye.